Hi, I'm Dr. Pham from Miracle Dental in Las Vegas. I have a lot of questions regarding dental veneers. So today I will answer a lot of those questions just to hope to help you understand better about this topic. So what are dental veneers? Dental veneers are thin shells of a material that usually made out of composite or porcelain that the dentist put on top of your teeth to correct any imperfections, any stained, any problem that you're not happy with. They are usually made out of either porcelain or resin material or composite material, which is similar to the filling material that you have. Keep in mind, veneers are only staying on top of your teeth. They are not covering the whole tooth as a crown would. So what are the problems that a dental veneer can correct? They can correct definitely the stained problem that you have. Sometimes you have fillings, you have little white dotted areas on top of your teeth, then veneer can definitely correct that. Sometimes you have teeth that are misproportional to or in proportional to the remaining of your other teeth. Sometimes your teeth are smaller or bigger than the rest of your teeth, then veneer can correct that. Sometimes you have gaps in between your teeth, then veneer can definitely correct that too. Veneer can also correct malaligned, like sometimes your teeth are a little crowded, rotated, so the veneer can help reshape and do mild orthodontic treatment to straighten your teeth with the rest of your other teeth. Sometimes your teeth are uneven in length. We can, or too short, or sometimes too long. We can definitely correct all that too. Next questions, are veneer permanent or removable? Very easy, it's permanent. The veneers are meant to be bonded. The dentist will bond the veneer permanently on top of your teeth, so they can last for a long time and they are stabilized, they're not coming out. There are some other type of snap-on veneers, but that's not what I'm discussing today. What should I expect during the veneer process? So it's really important you start out with the consultation. So you can share with the dentist what you expect. Then the dentist can do an examination, evaluate the situation, and come up with a realistic and achievable result. Then we will take some x-ray, we will do some scanning. We will send the record to the lab so the lab can make something called a mock-up. The mock-up is the proposed outcome. We will make the set of veneers or the restoration according to your request. We'll make it the length, the width, the shape, the color of your own choosing. After we approve, then we will start with the procedure. The day after the procedure, you come in, the dentist will numb you, make you feel comfortable. Then we will remove a thin layer of the enamel, very thin, paper thin. Then we will pack cords. Then we take the record either with the impression, the gooey material that you put in your mouth and wait for 5 minutes, or in our office we use a digital scan to scan, and we will send the record electronically to the lab. After that, you will be provided with a set of temporary veneers. We make a copy of the mock-up of the proposed outcome that we had mentioned earlier. We will put the temporary into your mouth while the lab takes about 2 to 3 weeks to make the permanent veneers. And along with that, you will share with us if you're happy or there's any fine-tuning needed. Then we will share with the lab, so the lab can definitely make you make the set of veneer to your liking. Then the day after 2-3 weeks, you come in, we will remove the temporary veneer. We will put the permanent veneers in. After you check the shape, the size, the color, if you approve, then the dentist will bond the veneers on your teeth permanently. In our office, we usually would like you to come back in a week just to check, make sure that you're comfortable doing a test run, make sure there's no problem, or if there is, then we will do the final adjustment in that visit. Next question is, will veneers match the shade of my other teeth. It's always our goal to give you the color of the restoration that match with the rest, so people don't know that is the fake or the artificial restoration. The difference is that you meant to do these veneers to improve the appearance. So we would advise you to whiten your teeth first so that you can improve the shade, and then we can choose the veneer, any color for the veneer that you like, usually to match with the nicer color that you just whiten your teeth for. So that probably will be the optimal result. Are there different types of veneers? Yes, there are typically two types of veneers. One is the porcelain veneers, and the other one is resin composite bonding veneers. In our office, we do the porcelain veneer majority of the time. The reason being is that they last longer, they're stronger, they're more translucent, more lifelike. They resist the stain a lot better. So it's a slam dunk that the dentist and the patient don't have to deal with the headache of having to deal with the crack, the chip. We don't have to replace it, and the results very, very pleasant. Whereas the composite bonding veneers, they tend to get stained easier, they're weaker, they tend to chip easier, and lots of time the edge where the composite meets the tooth tend to have the stain or tend to have cavity easier. Most importantly, the porcelain veneer are made by the lab. They have the microscope, they can sculpt and work on the veneer while it's outside your mouth, so they can do a lot more of a finesse of a job than the composite veneer, whereas the dentists work on it while you're in the chair. So the dentists have less control over the outcome. So in our office, when you come in, we will introduce you to do the porcelain veneer almost 99% of the time. Does the veneer require special care? Yes, definitely. Veneers, think of veneers as the exquisite, expensive, fine china, just like your fine china bowl or bowl at home. So you make sure you don't bite out an apple, you don't rip the chicken wing, rip out the meat, or open the beer bottle with them. Then they should last for a long time. Also, brush your teeth, floss them, do good oral hygiene, come in to see your dentist regularly, then the veneer will definitely be in good shape and stay longer without any problem. Next question, how long does the veneer last? As I mentioned earlier, with proper care, proper technique, the veneer should last you anywhere between 5, 10, some of my veneers even last 20 years or more. They require a lot of maintenance. Just be careful when you chew, when you eat. Don't chew on hard food, and come see the dentist. They should last for a very long time. Next question, how much does veneer cost, and does insurance cover the veneers? Veneers are strictly cosmetic. So when it comes to cosmetic or anything that is not basic necessity, the insurance doesn't cover. So the veneer costs anywhere between $1,000, $1,200 to $2,000 easily. Keep in mind, there's a lot of work, a lot of technique, a lot of lab time, a lot of care involved. So it definitely something that it's on a more expensive side, but the result is very well worth it. How do I know if I'm a candidate to get a veneer? Very easy. Look at yourself in the mirror. Ask yourself, am I happy with the way I smile? What is it that's bothering me? If there are certain things that you want to bring to our attention, please give us a call. We provide a no-cost consultation. It's free of charge. So just give us a call. We will sit down with you, go over your goal, go over the treatment plan, and you can be reassured the results very, very nice and very well worth it. There were a lot of good questions today. I hope I answered some of them, or if not most of them. But in case you have any further concern or questions, feel free to give us a call. Our phone number is 702-456-0056. Hope to hear from you soon. Have a great day. Bye-bye.